Hey, it's Jess and that's Matthew Holt. Looks like everybody is raising money this week but us, Matthew. What the heck is going on? Find out in this next 2 minutes of Health in 2.0. All right, sir, are you ready? Everybody's closing deals.
There's money that was supposed to be money falling from the sky.
To make it rain. Like, we should have like a make it rain thing.
We can make
this
it
must
rain.
be like the whiplash from JP Morgan.
So
all
maybe,
the deals have been done.
But meanwhile, in the Bay Area last week, it did rain a lot, but you weren't here. You were somewhere it was snowing. Where did you go?
I was in Boston. We talked when I was in Boston.
Oh, yes.
Mass challenge. Yeah, it's all coming back to. I was trapped there, actually.
And you were surrounded by Bostonians and couldn't escape.
I couldn't. I was trapped there for 4 days.
4 days. I'll let you out to California eventually. Thank you, JetBlue. Thank you, JetBlue, for bringing Jess safely back nearby.
Thanks for your free Wi-Fi, too.
Well, that won't last long. They'll figure out every other airline's trick soon.
No, I hope not. All right, do you have your timer ready? We've got a ton of deals to talk about. I love the deal flow.
Money. Here
we go. Okay, no, it's not going. No, still not going.
Now it's going.
Okay, Ciitizen closes a $17 million round. What does this company do? Why is this important?
So Anil Sethi, who was the guy who sold Glimpse, a Health 2.0 launch nearly winner, to Apple, which became the thing behind Apple Health Records, gathering your data from all those hospitals everywhere, has a new thing. His sister died of cancer. He wants to do data for cancer patients together. Andreessen Horowitz, late to the game in health technology, decided to kick in some money. Also, Devin McGraw, one of my great friends and top privacy lawyer in the country, moved away from DC to join their board, to join their team. So interesting. Good God, enough people have failed misery to make money out of the EMR integration in the PHL world. We'll see if they do better. I hope so.
Okay, what about Limelight Health with their $30+ million raise?
A big raise for a company that's been around a little bit of time trying to do that horrible thing better, which is when you're an employer, putting together those quotes that you have to give your employees or the employer's HR people. It's a complete mess, hasn't improved since the 1920s. I've just been through it with my company. I hope it works, but it's a big raise. We'll see what happens.
Oh, you still have employees? That's cool. How about the PillClub and their big round, $51 million? That's like a total of 67. This is like birth control, mail order delivery. Like,
I mean, there are so many on this. There's PillClub, there's NewRx, there's Pandia Health from the wacky and crazy and fun Sophia Yen. And of course, my Brit friends at Lemonade, all of them are saying basically we're not going to do specialized mail order telehealth and get pills to you over the wire. America's women better start taking all the birth control pills if these are all going to play out. But there's even Hers, which is the Hims company, who are doing it. So a lot of money in that space. We'll see there'll be some winners and losers. I hope it changes. But don't forget the big guys can do this too. The CBS's, the Marks, etc.
Absolutely. Employer wellness startup ADURO Health raises $22 million. Told you. Too much. Too many deals.
We didn't get through it all. Who was this one?
ADURO.
Finish.
The employer health one. The one with the employee wellness app, they closed a $22 million round.
Yeah, ADURO Health. Well, they are yet. What amazes me is that Al Lewis has been beating the living crap out of all these employer wellness things, and they never stop, right? That's
the thing. Why is this space continuing to get so much funding?
Well, I think it's the notion that people believe that self-insured employers are going to keep buying this stuff and that benefits brokers need something to sell. And why not? I've been talking to a bunch of these companies over the years, and the answer is there's still the belief that if you can get people onto a program that loses weight, that helps them lose weight and stop smoking, all these other great things, you're going to actually reduce employer healthcare costs. Hasn't really panned out. It would work on a national basis if you could get people to do it, but behavior change and habit change is really hard. But even you've got things like Walmart working with Kyra Bobinet engaged in and Fresh Try to change behavior. We've seen all these stories. We're still waiting for the solution. But I guess if you can crack the nut, There are so many employers out there and so many people who could, health plans who could use this. The people keep on throwing money in. It tends not to be good money. So it's maybe good money after bad, but good luck to them all.
I don't know. I mean, I'm going to change my behavior for my employer. I'm self-employed and I can't even do that. Like, I don't even know.
You're like me. Your boss is a complete boss and won't give you the time.
Oh my God, my boss is such a bitch. I hate her. I do. Seriously, the self-loathing is a real thing. So if you must also be self-loathing because you're watching this. And if you want to subscribe and continue to hate, you can, I was once the face of hate, so I know all about this. You can subscribe to our YouTube channel. Just search Health In 2.00, or you can also look on Twitter. The hashtag is Health In 2.00 as well. If you have any questions for us or any news or anything you want us to talk about, please make sure to send your ideas to me at Jess on Twitter or at Multiboy on Twitter.
Before we go, Jess, one last thing.
Yes.
Just another plug. We will be at HIMSS, Smack Health, WTF Health, the Healthcare Blog, Health in 2.0, and a cast of tens. We'll have our own booth. We've got one ticket left out of the 10. If you want to come exhibit in the booth, let us know.
Yeah, that'll be fun.
We're going to have a wild time. It's going to be great.
Oh my God.
Next to Google Health and next to Uber.
My friends at Health posted today on Twitter their party list. And I'm like, you've got a good sponsor when you're in absolute alignment about what your priorities are at HIMSS. I was like, yes, awesome. So yeah, check that out too.
Not the week to go out drinking.
Oh, please. All right, guys, that's the point of HIMSS. Thanks so much for watching. I'm Jessica Damasa. That's Matthew Holt. It's Health in 2.0. Thanks so much.